You know, after 56 years working in medicine and public health, I've had thousands of people come up to me and ask the same question. Dr. Fauci, am I wasting my money on vitamins? And here's the honest answer. For many seniors, absolutely yes. But for others, they're literally keeping them healthier and potentially adding years to their lives. Today, I'm going to break down exactly which vitamins actually work, which ones are a waste of your money, and how to figure out if you even need them in the first place. Because here's the thing, most people are taking vitamins they don't need while missing the ones they actually do. Stick around, because by the end of this video, you're going to know more about vitamins than 90% of people out there, including some doctors I know. Let's get into it. Welcome back to the channel. I'm Dr. Anthony Fauci, and on this channel, we break down health information in a way that actually makes sense. If you're over 55, this video is absolutely for you. In the next 24 minutes, I'm going to walk you through 7 major vitamins and minerals that seniors need to pay attention to, show you the science behind why they matter, tell you exactly how much you need, explain the difference between what the studies actually show versus what the marketing claims, and give you a simple framework to figure out which supplements are worth your money and which ones you should throw in the trash. No fluff, no corporate sponsorships, just science. So make sure you're subscribed and let's dive in. The first thing you need to understand is that most Americans, including most seniors, are deficient in at least one essential nutrient. That's not me being dramatic. That's the data from the National Health and Nutrition Examination Survey. When we looked at people over 60, we found that roughly 40% have low vitamin B12 levels, about 30% are low in vitamin D, and a shocking number aren't getting enough calcium or magnesium. But here's where it gets tricky. Just because you're deficient doesn't automatically mean you need a supplement. Sometimes you just need to eat different food. So we're going to sort through all of that today. Let's start with vitamin D, because this is probably the most important one I'm going to talk about. Vitamin D isn't actually a vitamin in the traditional sense. It's a hormone that your body produces when your skin is exposed to sunlight. But here's the problem. As we age, our skin becomes less efficient at producing vitamin D, and most seniors aren't spending enough time in the sun anyway. So what happens? Your bones get weaker, your immune system gets less efficient, and your risk of fractures and infections goes up. The studies on vitamin D are really compelling. A major meta-analysis of over 100 studies showed that people with adequate vitamin D levels had a significantly lower risk of bone fractures, respiratory infections, and even some cancers. Now, here's what you don't need to do. You don't need to take 5,000 IU per day like some of those supplement companies are pushing. Most seniors need about 800 to 1,000 IU per day, though some people with very low levels might need more. The best way to know? Get your blood levels checked. If you're below 30 nanograms per milliliter, you need supplementation. If you're above 30, you're probably fine with just some sun exposure and eating fatty fish. And yes, you can actually get vitamin D from food: salmon, mackerel, egg yolks, fortified milk. I see so many seniors spending $60 a month on vitamin D supplements when they could get most of it from diet and a 20-minute walk in the sun 3 times a week. Now, vitamin B12 is where things get really important, especially if you're over 70. Here's why. The ability to extract vitamin B12 from food requires something called intrinsic factor, which is produced in your stomach. As we get older, many people stop producing enough of it. This is especially true if you're taking medications for acid reflux or diabetes. A B12 deficiency doesn't just cause fatigue, which is what everyone thinks about. It can cause permanent nerve damage if you don't catch it in time. We're talking about numbness in your hands and feet, difficulty walking, and cognitive changes that mimic Alzheimer's disease. I had a patient once who came in with what everyone thought was early dementia, but it was just severe B12 deficiency. Once we treated it, her mind came back completely. The science is clear. If you're over 65, you should have your B12 levels checked. If you're low, you have 2 options. Either take a supplement or get injections from your doctor, which are actually more effective because they bypass the absorption problem entirely. Most seniors need either 1,000 micrograms of B12 supplement daily or injections every month. Let me pause here because I want to make sure you're really understanding something important. The supplement industry makes billions of dollars by selling you things you might not need. They use testimonials, they use celebrity doctors, they use fear-based marketing. When you see a commercial for a supplement promising to boost your energy or sharpen your memory, ask yourself one question. Where's the rigorous clinical trial data? And I mean real data, not a study funded by the supplement company itself. This is so critical because it directly affects your health and your wallet. Now let's keep going. Calcium is the third one we need to talk about, and this one gets really misunderstood. Everyone thinks seniors need massive amounts of calcium to prevent osteoporosis, so they start taking these big calcium supplements. But here's what the research actually shows. For most healthy seniors, the current recommendation is 1,000 to 1,200 milligrams per day, which you can actually get from food. 1 cup of yogurt, about 300 milligrams. 8 ounces of milk, about 300 milligrams. A handful of almonds, about 100 milligrams. A serving of leafy greens, about 100 to 200 milligrams. So if you're eating reasonably well, you might already be getting enough. The problem with taking too much calcium in supplement form is that it can actually increase your risk of kidney stones, and there's some evidence suggesting very high intakes might increase cardiovascular risk. So get your levels checked. Figure out how much you're getting from food, and only supplement if you're actually deficient. And this is important. If you do supplement with calcium, you need to take it with vitamin D and magnesium because you can't absorb calcium efficiently without those other nutrients. They work together. Magnesium is where I see so many doctors drop the ball. This mineral is involved in over 300 enzymatic reactions in your body, and most Americans, including most seniors, aren't getting enough of it. The recommended amount is about 400 to 420 milligrams for men and 310 to 320 milligrams for women over 50. What does magnesium deficiency cause? Muscle weakness, cramping, irregular heartbeat, mood changes, and sleep problems. The reason so many seniors are deficient is partly because modern soil is depleted of magnesium, which means the food we grow in it has less of it. So where do you get magnesium? Pumpkin seeds, almonds, spinach, black beans, dark chocolate, and yes, dark chocolate, at least 70% cacao, has a significant amount of magnesium. 1 ounce can give you 80 to 100 milligrams. If you need to supplement, magnesium glycinate is probably the best form because it's well absorbed and doesn't cause the digestive issues that some other forms do. Now let's talk about vitamin B6 and folate together because they work as a team in your body. Both of these B vitamins are critical for brain health, bone health, and cardiovascular health. A major study called the Framingham Heart Study followed people for over a decade and found that those with higher folate levels had better cognitive function and a lower risk of stroke and heart attack. Similarly, low B6 has been associated with depression, cognitive decline, and weak immune function. Here's the good news. Unlike some other nutrients, you can get plenty of B6 and folate from food if you're eating the right foods. B6 is in chickpeas, salmon, potatoes, and bananas. Folate is in lentils, asparagus, spinach, and Brussels sprouts. Most seniors don't need to supplement these unless their blood work shows they're deficient, which is relatively rare if you're eating a reasonably balanced diet. However, if you're taking certain medications like metformin for diabetes, you might need more folate. This is a good place to talk about something that's going to blow your mind. I've seen studies showing that multivitamins, those all-in-one pills that promise to cover all your nutritional needs, don't actually prevent chronic disease in most people. In fact, a massive study published in JAMA followed over 100,000 people and found that multivitamins provided no benefit for cardiovascular disease, cancer, or cognitive decline in people without specific deficiencies. So you're taking a pill every day hoping it's going to make you healthier, and the science says it's probably not doing much of anything. What does work? Getting your specific nutrients tested, identifying what you're actually low in, and then targeting those specific deficiencies. That's the strategy that actually works. Vitamin K is another one that gets overlooked, and it's absolutely critical for bone health and cardiovascular health. There are 2 forms, K1 and K2, and they do slightly different things. K1 is involved in bone mineralization and blood clotting, and you get it from leafy green vegetables. K2 is involved in cardiovascular health and bone metabolism, and you get it from fermented foods and animal products. The research on K2 specifically is really interesting. Studies have shown that people with higher K2 levels have stronger bones and lower cardiovascular disease risk. Here's the thing though, if you're eating a good amount of leafy greens and some fermented foods like sauerkraut or tempeh, you're probably getting enough. Most seniors don't need to supplement K1, but K2 supplementation might be worth considering if you have osteoporosis or cardiovascular risk factors. Talk to your doctor about that one. Let's talk about omega-3 fatty acids, because this is one where the evidence is actually really strong for seniors. These are essential fatty acids that your body can't make on its own, so you have to get them from food or supplements. The research shows that adequate omega-3 intake is associated with better heart health, better brain function, and less inflammation in your body. A landmark study called the VITAL study followed over 30,000 people and found that those taking omega-3 supplements had a significant reduction in heart attacks and cardiovascular events. For seniors, I generally recommend trying to get omega-3s from food first, 2 to 3 servings of fatty fish per week, like salmon or mackerel. But if you can't do that, or if you don't eat fish, a supplement of about 1,000 milligrams per day of combined EPA and DHA is reasonable. Just make sure you're buying from a reputable company that has third-party testing for purity. Okay, I need to hit pause again because I want you to really absorb what we're talking about here. The supplement industry is worth over $150 billion globally. That's billion with a B. That amount of money creates enormous incentive for marketing and for making claims that might not be fully supported by evidence. You're going to see testimonials from people who say a supplement changed their life. You're going to see before and after pictures. You're going to see celebrities promoting products. But here's what you need to ask. Is there a randomized controlled trial backing this up? Has it been published in a peer-reviewed journal? Was it funded by an independent source or by the company selling the product? If you can't answer yes to those questions, be very skeptical. Your health is too important to make decisions based on marketing. Now let's talk about some supplements that I'm going to tell you pretty directly you're probably wasting your money on them. Glucosamine for joint health, for example. Massive studies have looked at this, and the evidence that it actually works is weak at best. Yet I see seniors spending thousands of dollars per year on it. Coenzyme Q10 or CoQ10. The marketing around this is incredible, but the evidence that it provides significant benefit for most people is limited. Ginkgo biloba for memory and cognitive function. People spend huge amounts of money on this thinking it's going to prevent Alzheimer's, but studies haven't shown it to be effective in preventing cognitive decline. Now, that doesn't mean these supplements do nothing, but the evidence that they work for preventing serious disease in healthy people is just not there. Here's something else that's critical. The FDA doesn't regulate supplements the way they regulate medications. A medication has to go through rigorous testing, has to prove it's safe and effective, and has to be monitored continuously once it's on the market. Supplements, they're much more loosely regulated. Companies can sell supplements that haven't been tested in humans. They can make claims that haven't been verified. It's a wild west out there. Now, this doesn't mean all supplements are bad or unsafe. Many are fine, but it means you need to do your homework. You need to look for third-party testing. You need to look for companies that have a reputation for quality, and you need to talk to your doctor about what you're taking. So how do you actually figure out which supplements you need? Here's my framework, and this is what I recommend to patients all the time. First, get blood work done. Get your doctor to test your levels of vitamin D, B12, B6, folate, iron, and magnesium. Second, look at your diet. Write down everything you eat for a week and see how much of each nutrient you're actually getting. There are apps that can help with this. Third, look at your medications. Some medications interfere with nutrient absorption. If you're taking acid reflux medication, that affects your B12 absorption. If you're on certain blood pressure medications, that can affect potassium and magnesium. Fourth, consider your lifestyle. If you live in a place with very little sunshine and you have a desk job, you probably need vitamin D supplementation. If you don't eat fish and you're not vegetarian in a way that provides omega-3s, you might need those. Fifth, work with your doctor to identify which supplements are actually going to benefit you based on your specific situation, your blood work, your diet, and your health conditions. And sixth, buy from reputable companies. Look for third-party testing seals from organizations like Consumer Lab or NSF International. Let me give you some specific scenarios because I think this really helps. If you're a 68-year-old woman with osteoporosis, you probably need calcium, but get it from food first and supplement if necessary. You probably need vitamin D, especially if you live north of the 35th parallel. You probably need K2. You probably don't need glucosamine based on the evidence. If you're a 72-year-old man with high cholesterol and heart disease risk, you probably need omega-3 supplementation. You might need CoQ10 if you're on statins, because statins can deplete CoQ10, though the evidence on whether supplementing helps is mixed. You probably need vitamin D. You might need B vitamins if you have elevated homocysteine, but you probably don't need a multivitamin. See how this is individual? That's the key. One size doesn't fit all. Now I want to talk about something that doesn't get enough attention: the interaction between supplements and medications. Vitamin K can interfere with blood thinners like warfarin, so if you're on warfarin, you can't just start taking vitamin K supplements without talking to your doctor. High-dose vitamin E can interfere with blood clotting. St. John's wort can interfere with antidepressants and birth control and many other medications. Magnesium can interfere with certain antibiotics and bisphosphonates. This is serious stuff. If you're taking prescription medications, you absolutely need to tell your doctor about any supplements you're taking. And if you're taking supplements, make a list and bring it to your doctor. The cost thing is real too, and I want to be direct about this. Seniors are often on fixed incomes. When you're deciding between vitamins and your medications or food, vitamins should come last. Focus on getting your nutrients from food. If you need to supplement, target the specific deficiencies you have, not everything under the sun. You can get a year's supply of a targeted supplement like vitamin D for less than $20 if you buy a generic brand. You don't need the fancy, expensive versions. You don't need the ones that celebrities are promoting. You don't need the ones with 10 ingredients. Buy what you need, nothing more. Let's talk about timing and absorption because this matters. Fat-soluble vitamins like vitamins A, D, E, and K need to be taken with fat to be absorbed properly. So take them with a meal that has some healthy fats. Water-soluble vitamins like vitamin C and the B vitamins can be taken on an empty stomach, though taking them with food might reduce nausea. Some supplements compete for absorption, so you don't want to take your calcium and your magnesium at the same time. Iron needs to be taken on an empty stomach, but it can cause nausea, so take it with orange juice for the vitamin C, which helps absorption. These details matter because you can be taking supplements and not actually absorbing them properly. And here's something that surprises people. More is not always better, and sometimes more is actually worse. We have something called the tolerable upper intake level for different nutrients. For vitamin A, if you're taking too much, especially from supplements, you can actually get vitamin A toxicity, which causes bone loss and other problems. For selenium, too much can cause selenium toxicity. For zinc, excessive amounts can interfere with copper absorption. We've known for a long time that megadosing vitamins doesn't provide extra benefits for most people, but somehow that message hasn't filtered through to the general population. Alright, let me bring this all together for you because there's a lot of information here. The truth about vitamins for seniors is this. Most of you need some targeted supplementation, but not nearly as much as the supplement industry wants you to think. Get your blood work done to identify actual deficiencies. Focus on getting your nutrients from food first. Only supplement what you're actually low in. Buy from reputable companies. Tell your doctor about everything you're taking. And don't believe marketing hype. The science is the thing that matters. Your diet matters. Your lifestyle matters. Your specific health situation matters. Those are the things that are going to determine whether you need supplements and which ones. I've spent 56 years in medicine, and one of the most important things I've learned is that healthy aging isn't about taking a bunch of supplements. It's about eating well, moving your body, staying connected to other people, managing stress, and sleeping enough. Those are the foundations. Supplements are just the fine-tuning on top of that. So don't put all your energy into finding the perfect supplement regimen and then ignore the basics. That's backwards. Get the basics right first, and then work with your doctor to identify which specific supplements will help you based on your individual situation. If you do that, you're going to be way ahead of most people, and you're going to actually feel the benefits in your energy, your strength, your cognitive function, and your overall health. So what do you think? Are you taking supplements that you don't actually need? Have you had your blood work done? Let me know in the comments. I read every single comment, and I'm curious to hear what your experience has been. If this video was helpful, please hit that like button. If you're not subscribed yet, this is the time to do it. We put out videos about health science every single week, and we break down the real evidence so you understand what actually matters and what's marketing hype. You're going to get better at understanding your health. You're going to make better decisions. You're going to have better conversations with your doctor. Hit that subscribe button now, and I'll see you in the next video.